Hello everyone, this is Dr. Sonia, your doctor next door, talking to you from Dubai. Cough is a complaint which brings patients to the doctor's clinic very frequently. And I thought I should take this opportunity to explain to you what actually makes you cough and how do we treat it. Before we start with the cough diagnosis, let me just briefly explain what exactly happens when you are coughing. So as you can see, this is your respiratory tract. You breathe in air through the nose, obviously. It goes down through your windpipe, and this is what we call the trachea, and the bronchus, which is the windpipe, which goes and becomes very fine tubes of air which gives the air to the lungs to fill it up. That's how we breathe. Now, when you are coughing, if the cough is sudden cough with high fever and you have breathing problems and you have fever with chills and you have pain in the chest while coughing, these are signs of acute respiratory tract infection. This is what is respiratory tract. The infection can be at any place. Let's start from pneumonia. Pneumonia is infection of the lung tissue. So once this tissue is infected because of the germs, you get pneumonia, and the symptoms are what we just discussed: high fever, severe cough, chills, and breathing difficulties. The cough can also come if the air tubes are infected, what you might have heard as bronchitis. Bronchitis is inflammation of the airway. These the fine airways, if they get inflamed, the area gets reduced, the air does not go in properly, and patients might come with cough, with wheezing. Asthma patients have wheezing very frequently, and again it might be with or without fever. Now let's go slightly higher up. Another cause of cough can be originating from your nose. Yes, that is the cough which is that nagging cough which just won't leave you. It just stays there. It's like and you do this the whole day. There is some itching or irritation in the throat, and you usually throughout the phlegm in the mornings, early morning. What is happening is the nose, which is usually a bit sensitive in such people, the glands constantly produce mucus, and that mucus is going down and getting collected here in the throat. So through gravity at night when you are sleeping, this mucus is getting collected, and in the morning the body just throws it out. And that is what we call the cough related to your nose, allergic rhinitis. So these are three basic broad categories of cough. The acute cough with high fever can be pneumonia, can be bronchitis. The nagging, mild cough which just does not leave you for weeks and weeks, your nose might be the reason. So how do we work on it? If it is the pneumonia, yes, your doctor is definitely going to write antibiotics for you. They are going to write mucolytic syrups or agents. Mucolytic mean whatever mucus is getting collected, you have to liquefy it, and the body has to easily throw it outside. And that's what we work on. If it is bronchitis, the airway is very tight. So we have to work on the airway to open it up so the air can go in well. And sometimes we give inhalers, we give nebulizers, and some of you might have experienced that. On the other hand, if the origin is from the nose, you have to work on the nose. Nasal sprays, steam inhalation, antihistamines, all that works when the cause is at the nose. So that's it. I guess you get a bit more idea on what exactly is making you cough. And when your doctor prescribes medication, you will be able to understand it much better now. If you have any further questions you would like some explanation on, please write them under comments and I would love to explain them to you. Until then, wishing you good health. Bye-bye.